Welcome to Mom and Mine. I'm your host, Dr. Kat. On our episode today, we are talking with Allison Steger. She is a therapist, and she's going to be sharing her story through pregnancy and postpartum, where she experienced what she calls the sampler platter of issues, especially because what she was going through didn't necessarily fit into the description of postpartum depression. She experienced other things like postpartum rage and anxiety and birth trauma, as well as dealing with some body image changes. She describes her experience as just feeling like a bad parent. She just didn't know what was going on. And to a lot of people, it looked like she was doing just fine, but on the inside, it was a different story. She's now done her own healing and has started to help and support other people going through perinatal mental health conditions. Allison is a licensed clinical social worker certified in perinatal mental health. She owns Highwire Therapy, a solo private practice serving clients in Illinois and Louisiana, specializing in reproductive mental health through a feminist lens. She also runs The Matriarchy, a coaching practice that helps feminist mothers use rebellious anger and fierce care to lead their families and small businesses with pleasure, purpose, and personality. She shares a little bit more with us about her view of American motherhood and why we need a new culture of care. So let's hear from Allison. Welcome, Allison. Thank you for being with us.
Thank you for having me.
Always excited to hear from other therapists who've had lived experience and have gone on to shape their career and support other families. And each of our stories has some overlap, but they're also very unique and different. And since the listeners for the show are a mix of therapists and also people who are going through who are like not necessarily therapy professionals, right. It really kind of it works for both types of listeners. Those of us who are still supporting other families, and those of us who need to know that we exist, people yes. who've gone through it as well. So wherever you're comfortable, please share your story.
Sure. So I got pregnant unexpectedly when I was almost 30. And I was in a supportive but new relationship, and just decided that it was the right thing, and I felt like it was going to be okay, and went forward with it. And I think it's interesting looking back on that time, because I know I very much projected this outward sense of just moving along through it, feeling calm, feeling good, like just take it like it go. And I got some comments on how calm I seemed about it. But really looking back, I can notice a lot of that as just a disconnect, a feeling of sort of numbness, not in the sense of not being excited or not wanting the baby, but the overwhelm of what was about to happen just sort of, that's too much. I'm just going to cut off from that.
Okay, yeah.
Mm-hmm. And that really transitioned also into my birth experience, which I will talk about in a second. But I think it's also important to note just that at that time, I had a history of quite a bit of trauma in my adult years, and physical trauma. And so that sense of like disconnection and numbness was really in line. And I had done at that point a lot of therapy, a lot of work. I was in a good place. But I was also actively in the middle of an eating disorder as well when I got pregnant. So I had all these sort of little things going on, and thankfully that was a reason for me to really pull back on a lot of my eating disorder habits, and created a lot of space for healing, just by the fact of I don't want to do this while I'm pregnant. But all that just to say that there was a lot of like not active distress, but a lot of things happening. And then just combined with, my 30 years up to that point, and, life. So it kind of lent itself to this, like a feeling of disorientation. Like, this is the thing that I chose and I'm happy to do it, but also, what what's going on and where am I in this? So when I went into labor, my water broke, and I went to the hospital once I realized what had happened, and they told me that, they want to have the baby out within 24 hours, because otherwise I could get an infection of the fluid or something. And I was right at my due date. I was just a few days early. Mm-hmm. So, again, it was sort of this like, oh, okay. Like I kind of just thought that I would start going, having contractions, and I would hang out at home, and like, then we'd go to the hospital. And I hadn't really considered another option. And again, that sense of like, it'll probably just work out. It'll be fine. And so when that's not what happened, it really strengthened that feeling of like, I need to check out. I'm completely overwhelmed here. Mm-hmm. And I remember feeling just very much like helpless inside of my body, like this is happening. They started me on Pitocin in order to induce labor, and that was miserable. It went from 0 to 100 in like 5 minutes. And because of that feeling of disconnection with myself and my body, it was really hard to be able to like lean into the pain and just sort of be with it. And it was also really difficult once I chose for an epidural, because of the sense of numbness was really jarring as well. Like nothing felt right. Mm-hmm. Yeah. So a lot of medical interventions that happened, a lot of just furthering that sense of like, I am not in charge of my body. I can't do this. I'm not strong enough. What was I thinking? Eventually leading to an emergency C-section, because I was actually getting an infection of the amniotic fluid. And so that actually felt sort of like a relief when that was on the table, because I had, been trying to push the baby out, and she just was coming out and then popping back. Mm-hmm. And just not getting anywhere was really hard. But, it's a major surgery. It was a lot, very fast. And, you're in this haze state. And so it's, again, just like something, okay, this is just happening. Like they're just taking the baby out now. And it was that experience that I think so many people probably listening to this podcast know so well, of like, all right, well, the baby's out and she's healthy and you're fine. Like, we're just going to give you antibiotics and it's good. So cool. Mm-hmm. Carry on. Right. And, that's just not it. And I think still at that point, I was in that space of like, okay, yeah, sure. Like, let's just move along. It's fine. What the hell just happened? But also I can't think about that too much. And so immediately kind of went into this place of like over functioning, and let me prove like that how much I have this. And I remember being on the operating table, and one of the doctors making some comment about like, oh, your body, like you exercise a lot, so like you're gonna just bounce right back and you're gonna be fine and you're gonna look great. And like that stuck in my head, like, okay, I have to like prove that. Yeah. So just immediately was like, okay, I'm not gonna lay around in bed all day. I'm gonna get up, I'm gonna cook, I'm gonna clean, I'm gonna take care of this baby, and I'll be fine. Like, it's not a big deal. I don't need any help. And no, that's not, that's bullshit. But that was the way that I knew to feel okay and to stay in control of things. Right. And just really having to like prove how much I have this. Now, in the meantime, this is what I was projecting and how I was kind of getting through my days. But underneath, there was just this sense of total panic, which didn't manifest itself as what I would say is like traditional postpartum depression or even anxiety, which was interesting because I'm a very anxious person, and I for sure thought that was going to come out. And it was more like this, again, this like complete dysregulation. Like I'd get completely overwhelmed. I'd be like screaming into my pillow. I'd be like feeling so angry towards my daughter. Like, why aren't you breastfeeding the right way? Or why are you still crying? Why won't you go to sleep?
Mm-hmm.
And then of course, just feeling like so awful that I could even be thinking about that
Mm-hmm.
to this baby. Like I
Right.
recognize that she's a baby, but
Right.
also I feel totally in distress here
Yeah.
and couldn't quite explain what was wrong because it didn't seem like there was enough quote wrong with me to ask for some sort of help or to tell someone how I was feeling. It just felt like if I was feeling bad, it was because I couldn't handle it.
Can I ask a question?
Yes.
As you said, that feeling of over functioning, like you needed to do everything on your own. Was there help available and you didn't want the help, or like you didn't have the help, so you had to do everything on your own?
A little bit of both. So my partner is he travels for work pretty extensively and always has. So he was gone about half the time, and there was a part of me that felt very much like, yeah, go ahead, go back to your job and just go do this because I can handle it, because there was an association of the more I can handle, the more valuable I am as a mother and as a human. So it's not that there wasn't help, and I was very fortunate in that way. It was that I did not feel like I had permission to actually take it. Like people would offer it, but there was that sense of like, but they don't really want to do this, and I could handle it, so I shouldn't bother them. Yeah. But yes, a lot of the time I was physically alone and in charge of kind of handling everything day to day. So yeah, that's how it was for a very long time, and just continuing to feel really adrift and like, okay, today's the day I'm going to get it together, and I'm not going to get frustrated, and I'm not going to, scream in the bathroom shower, like bang on my steering wheel when my child, is screaming in her car seat. And, recognizing now too that I have a, much like me, very highly sensitive child who was, she cried a lot, basically. And that sound and that feeling of not being able to help her, which I don't think is unique to me, but it was like, so like just nails on a chalkboard, and just couldn't believe that I couldn't get it together and figure it out. So yeah, it really just felt like I didn't have a place in getting help, and not in the sense of there were no resources, but in like I didn't recognize my story, because I looked like I was not in a lot of stress or like, this classic depression, like I was showering, I was going to work, I was seeing friends, I was, doing all these things. But I had also not heard of like postpartum rage at that point either. I just thought I was a bad mom. And I don't even remember where the first time I heard it, but the physical reaction I had of like, yes, this is what this is. And it's not a pathology, and it's not, something that's deeply wrong with me. It is the way I'm trying to express my needs. This is how my needs are coming out. And I am not getting what I need right now to be able to function the way that I want to.
So how far, can I ask how far into your experience into the postpartum were you experiencing that, and when you found out or figured out what was going on?
Yes, I would say the first probably 3 years, and I was seeing a therapist, and she was incredibly helpful. She was wonderful. And but it was just such slow work of like getting me to believe that, I was allowed to have self-compassion,
Mm,
that a lot of my responses were based in old trauma and and needing to have control and
mm,
needing to check out for
mm,
myself as a way of safety, and starting to like put those pieces together.
yeah.
So I was very thankful to have that. And I think it finally clicked together in a way when my daughter was about 3 or 3.5. Um, I would say that also coincided with the 2016 election, which just sort of snapped me to attention with a lot
Mm,
of things, and made me feel like I needed more autonomy and I needed to be awake and alert, and
mm,
for myself, for my daughter, for the world. Um, you know, much too late, but here we are.
mm,
So that did sort of feel like a catalyst to like, okay, I've got to come back to myself here too, and not have my entire identity be what I can do for my child, and then feeling like just it's never enough and being in that cycle,
mm.
and then just feeling so burnt out and overwhelmed that all I could do is lay around and watch TV or be on screens. I wanted to come back and have more autonomy in
Mm.
my identity and my being.
Did along the way, I may
Mm-hmm.
be looking back, but did anybody know that you were like suffering in the way that you were? Well, I guess
I
that's
don't
my
think
word,
so.
suffering, but yeah, could anybody
Yeah.
tell?
Well, I think my husband, definitely saw my, outbursts, or, would hear me like getting very frustrated.
Mm-hmm.
I think he didn't know where he fit into things, because part of my thing was like, I have to be the one to fix this. Like, I have
Mm-hmm.
to, you know, bedtime was like a 3 hour ordeal for like a
Mm-hmm.
really long time. And I would not give it up. It was like I was certain I had done something to make this not work. I
Mm,
didn't know the magic, sleep training or whatever protocol. And so I had to, it was like a dog with a bone. Like I had to fix
mm,
it. And
mm,
he might kind of check in and I'd be like, get out. Like this is,
mm-hmm.
I have to
Mm-hmm.
do this. Um, it felt like the only way to prove, again, like I had
Mm.
to
Yeah.
accomplish some sort of t- task in order to prove that I was a good mom.
Mm-hmm. Mm.
So
Yeah,
yes, I think I was
that's a
pretty,
really that's intense. And it's
yeah.
exhausting to
Mm-hmm.
have that drive or need or whatever it felt
Mm-hmm.
like for you to have that much within your control is so exhausting.
Mm-hmm.
Did you ever feel that exhaustion, or did it just like looking back on it again, did you feel tired or burnt out, or did it just like kind of fuel more of the ragey feelings?
Yeah, I think it was more, I definitely did not experience it as like a lethargy or like, oh, I can't get out of bed. It was more,
Mm,
it had that agitated edge to it of
mm,
like, gotta keep pushing through. And I could
mm,
see just by, I mean, there was definitely that feeling of like, my days are not fun. Like, what is this?
mm,
And I don't have like, I can't read a book. I can't, like, all I can do is like watch Bravo at the end of the day, which I love Bravo. We're not knocking Bravo. But it didn't feel like I was really able to like have a hobby or like commit
mm,
to anything else or really show up in my friendships the way I wanted to. And it was sort of like, when I get this mom thing figured out, then I can do that.
mm,
And
mm,
part of what my therapist helped me with was like, how about you start doing some of that now and just see what happens, like little by little, where can you do this and let go of some of the like, hyper productivity and hyper independence, and
mm,
back off of some of that and start to like allow your nervous system to settle and actually feel your feelings
mm.
and trust that you can be safe
You're
with
like, wait a
them.
minute, no.
Yeah.
No thanks. Yeah, it's hard to allow that to happen. It's
Mm-hmm.
really hard.
Mm-hmm.
Especially if it's whatever for it shows up. Obviously, you know this very well. It's different for different people. Like it can be scary or intimidating or vulnerable
Mm-hmm.
or like many different things. Yeah.
Mhm.
Feeling your feelings is hard. It's hard,
Yes.
and it's hard work.
Yes.
It's feelings. Feelings aren't like
Mhm.
a weakness. It's actually, it takes a lot of strength to allow yourself to experience them.
Yes. Yes. And you have to slowly widen those edges of safety in order to be
Mm-hmm.
able to do that because,
Yeah,
it's like a whole new way of being that you have to learn.
yeah, for sure.
Mhm.
So with this new, I guess, understanding of what you're experiencing, having a name for it, and having that relief that you described, how did things shift and change for you?
Yeah, it really helped to separate, me as a person and me as a mother. Like it depersonalize it. It's just me having feelings,
Mm-hmm,
like
mm-hmm,
like we all do.
mm-hmm,
And this was just how mine were coming out. And so that was helpful in like taking the edge off and helping to get out of that guilt and shame cycle.
mm-hmm.
So there wasn't then just like that rebound, like um, doing the same thing over again and then vacillating between the rage and regret
Yeah, yeah,
cycle, and being able to use that compassion of like, I'm not acting like this because I'm a bad mom. I'm acting like this because I'm overwhelmed by this, and this.
mm-hmm,
And that common humanity, right? Like most people would be. People have different thresholds for what triggers them and upsets them, and so
yeah,
here, this is where I'm at. I think it was also helpful too, and this is why I bring up like this coinciding with the election, because then it started this whole understanding of really going more into, like structural oppression and racism and sexism and things like that. And as I was learning about that, obviously, well, like obvious people can't see me right now, but I'm a white woman. And so I was obviously learning about my positioning in this. And then also understanding as a woman, just how the patriarchy and things try to weaponize anger
mm-hmm,
against women, weaponize caregiving against usually women of color. And so having that ability to zoom out to and sort of toggle between like my individual experience and see like this is the water that we swim in, and
mm-hmm.
it makes sense why I have internalized a lot of these things about what it means to be a good woman and a good mother, and what that looks like, this gentle and quiet and never raises the voice and is always available, um, and to be able to like realize actually there's a lot of stuff that we can be angry about.
Mm-hmm.
And the fact that our anger is seen as, unmotherly or something is because they, like the man, the systems
Mm-hmm.
don't want us to have it and be tapped into it, because then things would have to change.
Mm-hmm. Mm-hmm.
So, yeah, I mean, this whole process has sort of been like, okay, drop in what's happening for me. And then also, how do I see that in a larger context?
Mm-hmm. Right.
Which has been helpful also in my work as a therapist. Obviously, I'm a social worker, so we learned about like, structural issues and person and environment and things like that. But the more you just sort of nuance it and understand like everything that your client is coming to you with, even if it does meet a DSM criteria or something, it doesn't have to be deeply pathologized. And there's always information coming from their identity and how they've moved through the world and what's kept them safe and what's
Right.
felt harmful to them. And so I use that a lot in working with motherhood.
Mm-hmm. Yeah, it's so helpful to have a fuller perspective. I'm obviously,
Mhm.
I stopped myself because how can we ever have all of it? But
Right.
yeah, it's so infuriating how, like you said, typically women are treated in the
Mhm.
caregiving space. And just the amount of pressure that comes with this role of motherhood it's unreasonable to say the very least.
Mhm.
There's far too many expectations on one person to
Mhm.
be all and do all. So the rage you were in part feeling was I don't know, therapist to therapist. I'm like, was this like some part of internalization of those
Mhm.
systems? It like also with,
Mhm.
you know, all of the other things that you had experienced in your life, just that pressure to do and be
Mhm.
all is rage inducing.
Right. Right. Yeah. And that is rooted in, like just my personal experiences of trauma too.
Mm,
Oh, this happened. It was my fault.
mm-hmm,
That when something feels inexplicable and too big and overwhelming, like, oh, I can make some sense of it by blaming myself and
mm-hmm,
being angry and turning that rage inward.
mm-hmm, mm-hmm.
Mhm.
Yeah, super fun to it happens so I mean, I'm being you know, sort of flippant about it, making a joke, but it happens so fast.
Mhm.
Before you even know it, you feel bad about
Mhm.
something.
Mhm.
It's just
Absolutely.
like you said, in the water.
Right.
So with now having that much bigger perspective, the
Mhm.
macro, I guess, as well as your lived experience, how did that shift things for you
Mhm.
in your healing?
Me personally,
Yeah. Mm-hmm.
yeah. It just feels less personal. Like there's so much more room for kindness and grace for myself.
Mm-hmm.
And also for, that just ability to analyze and the ability to push back against these sort of oppressive norms, right? And
Mm-hmm.
in even to ask for help or to be in community and not in competition with other people, with other parents, and to defy perfectionism.
Mm-hmm.
One of
I
my
like
friends
that.
said she's working to be actively anti-perfectionist. Like you can be like actively anti-racist or anti-sexist or something,
Mm-hmm.
instead of just not being imperfect. Um,
Yep.
and so, yeah, it's just this ability to question, like, wait, and I'm feeling like this. Why? How much of this
Mm-hmm.
is an actual authentic experience, and how much of it is someone else's voice in my
Right.
head?
Right.
And that just really helps clear a lot of the clutter,
Yeah.
and kind of come back to what's actually happening for me and what I need.
Mm-hmm. Right. Yeah, that's fantastic. Um, because it really prevents you from going too deeply into like you being the problem, you meaning all of us,
Mhm.
but like you being the problem,
Right.
and putting yourself in context of you know the
Mhm.
system you're in and the world you're in and the
Mhm.
environment you're in and all of those things.
Yeah.
So yeah, so once you have that perspective, how did you then start to roll that into the work that you do?
Mhm. I mean, just that word context is everything.
Mm-hmm.
And, a lot of times, when I'm assessing somebody or we're just getting started, we might talk about, like, especially if we're using insurance or something, you got to go through here as like the DSM diagnosis, here are the symptoms and blah, 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 all that. But I always say, like, this is low context, right? This is a
Mm-hmm.
checklist. Or if we do like the EPDS or something like that, like this is just one piece. And, we also want to start by naming the fact that it is just traumatic to be a birthing parent or someone, in a reproductive age, a mother, a birthing parent, and in this country right now,
Mm-hmm.
in a lot of the world, but I'm going to speak to, what I know here. Um, and, we have to take that into account because that helps us see, like, this is what we're working with, so it makes sense that we respond in these ways.
Mm-hmm.
And can we thank those ways for helping us, and for trying to keep us stable, trying to keep us safe, but also maybe understand if they need to be put away, or something new needs to come to the front to help, now moving out of these like trauma responses, of like trying to be the perfect parent, trying to do everything for your kids and self-sacrifice, those are trauma responses to a society that tells you you're not allowed to be fully human as a mother. So when we can I know this all sounds very intense. We don't just like spout this out at them.
No, you're good. Let's do.
This is like overtime.
Right. Yes.
A PowerPoint presentation for our second, our
Right.
second
I
appointment.
understand what you're saying. It's you don't give this to the clients
Yes.
all at once. Yeah. I'm like, I
Yes.
think the audience can handle it.
Right. But I do actually, I name that villain as the mommy complex. It's not you. You're struggling because you're within this, but it's not like you don't have something broken or like inherently wrong with you. You are responding to existing within the mommy complex, which is just a name for like how white supremacy and the patriarchy, capitalism, and diet culture all like inform parenthood.
Yeah.
So being able to say like that's the responsibility of that, and here's how you're responding to it. And what we want to look at is how you're responding and see if there's a way we can work to find something more helpful for you.
Yeah. How do people respond to like giving it a name like that?
I mean, some people are like, okay, whatever, but it's not so much about the name, right? It's just
Sure.
can I name what's happening? And so I think some people will be like, oh yes, like, oh, that makes sense. Other people are like, I think it's actually just me, so it is, but even just being able to say it, to have someone hear it once, like, I think it does start to plant a seed or it starts to shift something. And I'll even say sometimes like, I'm going to do that annoying thing where I'm like, I think this is actually, just a symptom of like, what messages have you heard about what it means to be a parent or mother? And again, just like that toggling in and out, modeling that for them, I think does something for everybody, some more than others, but
Yeah, for sure. And like very specifically, I mean, I can see what you're saying that for people who might have a harder time seeing that it's not just them, that it could take a little bit longer there. But I wonder if this, just as we're talking about it, I'm wondering if like, gosh, I bet that's really effective for anger.
yes. Yeah, because there's someone you can be angry at. It doesn't have to be you. You don't have to be angry at yourself. And they're usually not angry at their children or their partner. I mean, it's like, they might come out as like feeling anger about a situation, but it's not, mothering that you hate. It's like the constructs of motherhood. And so it helps to direct it a little bit and pull it out of themselves. And that again just gives room for things to settle a little bit more, because that anger isn't just swirling all around inside them along with that shame and guilt. It's like, here's a place for it. Here's someone to target it at, meaning these systemic messages and norms that we have.
So in terms of yes, there's a lot of that emotional stuff that can be explained, like how and why we as mothers, let's say, feel and experience these things. How about for the how well moms in this scenario, or it can be primary caregivers even receive care or are offered care as it relates to like this bigger systemic stuff.
Yeah. So I think, one of the big through lines for is the idea of sort of like self-sacrifice or like having to fragment yourself. So, this is not a new thing, but like my needs come last, and I shouldn't have any needs. And when I am in my parenting role, nothing else should exist. I should just be giving of myself here. And so, and then the idea that I'm talking a lot about mothers, but And the reason being not because, mothers are the only caregivers or because, it's only mothers who are birthing parents, but it's just the sense of like, that is the expectation that mothers are female and feminine and that they, then can be, sort of exploited and their care is just like a natural thing that they love to give without end. And so those gender norms are really strong in who we think of as caregivers and who often gets defaulted as caregivers and how we define motherhood too or parenthood. So and then I would say also like the perfectionism and the feeling of having to perform a role and kind of always be on as a parent. There's not room to ask for help or to find care. And often I found that a lot of, and I know this is true for me, but a lot of my clients too will, they don't even know what they want or need. They just don't. I don't know what I like anymore. I don't know. I can't even sit still to rest and think about this. And
Right.
so then that's like, well, this doesn't feel good and I don't know what I want anyway. So I'm just going to keep doing the laundry or something like that.
Right.
Yeah. And just this feeling of like smallness, like you have to just be this one thing. And so another really important piece of like through line in my work is just who are you as a person? Who were you before you became a parent? Like let's start to access some of that and carry that through because the things that are just brilliant about you, just as a human being on this earth, are the things that are going to make you brilliant at your specific type of parenting that nobody else can do. It's you. And so it's not about having to be perfect or perform a role or whatever. It's about finding those strengths within yourself and those values that are important to you and your personality and just bringing that forward. And then that helps also figure out what do I need? How do I care for myself? How do I make room for myself within this one part of my identity as a parent and start to integrate it rather than being like, now I'm a mom, now I'm at work, now I'm with my friends, you're just you wherever you are. So let's pull it all together.
Yeah, for sure. And I do think in some ways that job or burden or whatnot is often on the person who is themselves struggling or at odds with themselves in some way or having difficulty in this transition into this role. And it's really hard because not necessarily like people can't necessarily see anything from the outside
Right.
that this person is struggling with their identity, who they are as a new parent, as a new mom. So anyways, for the most part, it seems like there's not a lot of help being offered either.
Yes. I think it's an important what you're saying, like to distinguish between like we're looking to build your sense of identity not from a place of like you must be fully self-actualized and like but more from a place of listening and self-compassion and like really dropping in more to knowing yourself, which for many women or people of marginalized identities, it's like you often are told not to trust that and not to drop into that, and whatever you have is not enough and you should be looking for some other way to fix yourself. And so we can start very small, just like working with those self-compassion skills or checking in on your body. Like, do you need to pee? Are you hungry? Like, can you feel your feet? Like these very simple things, but they're not that simple when you've been disconnected from that your entire life. So dropping into that sense of identity not as like an external achievement, but like an internal reconnection.
I love that. Yeah. And it's so necessary because, right, for all of the reasons and all of the systems, there are a lot of ways in which either we were never allowed to be connected to ourselves in that way or it's been severed by
Mhm.
any number of things that we've had to go through as people, where we had to cut parts of our identity out or turn them off in some way.
Right.
So, in terms of the work that you've been doing, you're working a lot in the perinatal mental health space,
Mhm.
but you've also decided to offer a couple of other ways to help support families. Would you mind sharing that?
Yeah. So I have a private practice. I'm a licensed clinical social worker, and I'm licensed in Illinois and Louisiana. So that's sort of my daily day-to-day work. But in sort of working through all the things that we've been discussing, I also wanted to do some different offerings too that maybe weren't necessarily therapy, although they're therapeutic in their
Mm-hmm.
own way. So I created a second business called the Matriarchy, and I do a couple different things there. One is running groups that really just center the make space for the transition into motherhood. And I say transition in quotes because I've worked with people who, their kids are like 10 years old, but they
Mm-hmm.
just never had that moment of, oh, we can talk about what this is really like. So we do, a lot of um, uh, kind of being in community with each other, talking about the grieving that comes with becoming a new parent, and talking about using anger or other strong emotions to our benefit, allowing them to tell their stories, and talking about the mommy complex as
Mm-hmm.
well. But really just like giving that room. And then I just recently started also offering some business coaching. So working with mothers who I are in like care-based businesses, so therapists, coaches, birth workers, et cetera, who want to start their own small businesses or like private practices.
Mm-hmm.
I think I'm one of those rare people who really liked the learning the business end of like
Mm-hmm.
building a private practice, and I was like, this is cool. And I was like helping other people kind of informally do it. And I was like, well, let me turn this into something. Um, so again, using their personality, values, the things that they really stand for to carry through into these businesses, the same way like I really care about helping birthing parents and mothers and families and working in this space, and I want my actual business and practice to reflect that, because we
Mm-hmm.
need more really solid progressive feminist businesses in this world, and we need more care in the world too.
Oh, right, for sure. Yeah, that's great because it sounds like all of the principles that you've been talking about really carry through into all
Mhm.
parts of how you're supporting other people, really checking
Mhm.
in with who are you, and figuring that out and how to
Mhm.
expand on that if needed and wanted, and whether that's like through a business or internally and or within their own personal life. It's a fantastic perspective and way to support somebody be themselves in
Mhm.
their life in more than just one way.
Yeah, thank you. I
Yeah.
had fun with it.
Good. Good.
It's
That's
also just helpful for me just to have the variety too of like, okay, I've got therapy and then I've got these other things, and
mm-hmm, mm-hmm.
it's nice to have different buckets to put in your work.
Yeah, for sure. And especially if you feel driven and motivated and you know you can help somebody who
Mhm.
needs that kind of help. That's a great feeling. All right. So with your own experience and all that you've learned along the way and all that you're helping others with now, what's something that you want parents to know about becoming a parent in this day and age?
Mhm. I think it would be that for as small as society and our culture tries to make us, like parenthood is a leadership practice, and it's an initiation into power, and we have the ability to wield that in a way that's really helpful and meaningful, and that allows you to show up in it and to be fully human in it. And um, exactly as you are. And so there is a place for every parent, and there is something magical about every parent. And there are struggles that every parent has, and that's just the human experience. And I just want parents to remember that, they are lovely just as they are.
Awesome. Perfect. Or not perfect. Just kidding. Yeah. No, I really appreciate that perspective. Thank you for that and for coming on and sharing all of this with
Yeah.
us today.
Thank you for having me.
You can connect with Allison at highwiretherapy.com, welcome to the matriarchy.com, or on Instagram at We Are the Matriarchy. For sure, please do share this episode far and wide. And as always, I thank you so much for being with us. Until next time.